All right, here we go. Welcome back to another episode of Beyond the Check Service Industry Podcast. I am Reyshan Parker, and if you haven't yet, please go watch my television series Beyond the Check Worker Owner Edition, now streaming on Amazon Prime and Tubi TV. Tubi TV, it's free TV. And if you are listening to this in the future, you could have listened to it live on Tastemade weeks ago. So go follow Beyond the Check on Tastemade and stick around for all kinds of fun live events like behind the scenes cooking shows and other fun cooking stuff. Anyway, I have a fantastic guest today. He has been a family doctor for over 40 years. He's now retired and is a healthcare consultant and life coach. And he's also dealing with one of the human race's favorite parts of life, helping people through death. Ladies and gentlemen, Dr. Forrest Jones. Hi, Forrest.
Thanks, Reyshan, for having me on. You're so kind.
I try, sir. I try. You're so kind for being here. Where are you today?
I'm in Chicago, Illinois, and the weather is pretty nice. It's in the 60s and not humid with sunshine.
Good for
How about
you.
that?
That sounds lovely. I'm jealous. I mean, normally you'd be jealous of where I am, but today it's like 90 degrees with like 100% humidity, and yeah, it's just not pleasant to go outside in Savannah, Georgia.
That's rough.
But Chicago sounds great today. I'll trade you anytime. So I guess we'll just get started with a little bit of history. You've been a doctor for over 40 years. What made you want to get into the medical profession?
That's a good question. I would say the short answer is just curious, curious about people, and curious about the human body. And I was just really fortunate to be able to get a marriage of those things in one career. And I've been happy with that all the way through. It seemed to be match made in heaven for me.
Very nice. So was you anybody in your family doctors or
Not at all.
no? Just
Although I would say this, my mom was ambitious. I have three brothers, and I've got one right under me, 18 months apart. And she had this thing in her mind. It might have been from her own family doctor, but she had a vision of having a Jones clinic. My last name is Jones.
yeah.
And I would be, my brother and I would be practicing there. Never happened like that. I was the only one who went into medicine, and none of my three kids went into medicine either, but that's okay. That's
you're
quite all right.
you're the medicine man of the family.
That's right.
There had to be one.
That's right.
So 40 years of family medicine.
That's it. Primary care. And that's just a great fit for me because it is interactive. You want to bring the technology and your knowledge base, but you really want to find a way to serve the people in front of you. And for me, that was really part of the joy because it's like having a front seat on life, right?
To everybody and everything, because you cover, you not specified, right? So you'd see all kinds of different
General
patients.
practice. Yes. In my training, not only was I trained to take care of adults, but also to be an obstetrician, basically to bring birth and to treat children as well, and office gynecology. Some some doctors who are in my specialty, I think we all tend to eventually gravitate to what's a good fit for us personally. So for me, ultimately, it ended up being pretty much geriatric medicine. I gave up the obstetrics part because I just wasn't doing enough deliveries to feel comfortable for whenever that emergency would come up, because sooner or later you're going to run across something really difficult. And if you haven't had a lot of experience, that could be a pretty bad outcome. And that scared me. And I knew I didn't love it enough to stick with it. And so I just let that go. And then eventually pediatrics, I let that go as well because the vaccines were changing so much. And I have to learn to keep up with all the new variations and combinations of vaccines.
What
And my
when
pediatrician colleague kept
late 80s?
letting me know. I'm sorry?
Would that have been around like the late 80s?
Well, for me, it was after 2005 when I gave up pediatrics. I was pretty much continuing
Oh,
up through then. Yeah. So
so
I was pretty
that's
much
when all
into
the new vaccines came out. Because I
exactly.
there was like a whole bunch. There was only like five, and then
That's
all of a
right.
sudden there was like 20.
And combinations thereof, and my pediatrician colleague would say, "No, you didn't get this right. You didn't get that right." And I didn't love it enough to really try to get a handle on it. And so I just asked my pediatrician colleague, "Do you mind just taking care of all of these for me and let me focus on what I enjoy the most?"
So even when you're a general practitioner, everyone seems to like over time flow towards a more specific
Yes. I had
practice.
some colleagues who went toward emergency and urgent care. That's what they loved. Others did more pediatrics, others did more obstetrics, others maintain a broad range. And especially if someone is in like a rural area where there just is not much of an opportunity alternative for people, you pretty much have to wear all those hats and keep wearing them because you are the guy, you are the woman.
You're the
So
town doctor.
you are the doctor. That's right.
Did you have
I'm
have
here
you
in
ever
Chicago. I had specialists in everywhere, so I didn't really have to. I could actually focus on what I enjoyed the
correct?
most. Hmm.
But if you lived in small town Missouri, you
Yes,
you would have been it.
that's right.
You'd have
That's right.
you'd have a little doctor bag and
Well, I did do home visits for a while. That was part of my training was to include that in our training at Cook County Hospital. Um, and matter of fact, about 2014, I left a group practice that I was in. And that's probably because my mom was getting ill and I had to be there for her until she passed. And then after that, I joined a home visit company. And so for about a year and a half, I was doing exclusively home visits, which was fun.
I didn't know that was the thing.
Mhm.
I thought the home visit doctor had gone away a long time ago, but I,
It had, and it's coming back in different ways because people really need that. And especially as you have an aging population, and many people don't necessarily have someone who can bring them to the doctor's office. So they become homebound. And
and sometimes they're
need
just
these
not
agencies to
capable
help.
of moving to the hospital and
That's
back and
right.
forth all the time, right?
That's right.
Well, that makes sense. I'm surprised.
Yeah.
I'm surprised there's not an app for that already.
I guess waiting for somebody to invent it. I'm sure that's coming.
Right? I'm sure it probably is.
Yeah.
So, so with your mother passing, and so you wanted to get into, I don't know. I guess all doctors are really trying to maintain life, but as we get older, it really becomes more finite in the timeline, I suppose, of what extending life or maintaining life is. So maybe we can talk a little bit about uh, what you do for maybe not full on critically ill people, but just as we age, is over our 70s and getting older, how to try to keep ourselves spry, I suppose.
Excellent point. Excellent point. Because one thing I learned when I was power of attorney for our mother was that I was not having these conversations with my own patients. I was always focused on making sure they were taking all their medicines, had the right treatment plan for controlling any, if they had a chronic illness, making sure we're trying to optimize that for them. Um, but really focused on prevention and curing. But, you know, one thing that we have no control over is the fact that we're going to leave here eventually. And I was not having helping people to be better prepared for that because what would happen is I, as the primary doctor who my patients knew the best, was not having these conversations with them. And so what would happen is they'd have these conversations with someone who they didn't know. They might go to the emergency room with a really bad situation going on, and the emergency room doctor or the intensive care physician is the first one having this conversation with them about what their wishes are. Do they want to have all these interventions and procedures, or do they not? And I thought, first of all, I've done a disservice, even though I'm thinking I'm giving good care because I'm really focusing on prevention and curing. I really have kind of dropped the ball for my patients because I haven't prepared them to answer these questions. And I'm the one who knows them best as far as clinicians are concerned. And then
those are
also,
hard questions to ask and deal with, and
they really are.
And the family members don't always even ask that. I'm thinking about it right now, and I'm like, man, I don't think I know all my mother's wishes.
Yeah,
You know?
good point. That's an excellent point. And also, I was doing a disservice to my colleagues because my emergency room colleague, my intensivist colleague in critical care and intensive care unit, why should they be the ones with that burden? Because then it's a real urgent situation. They're trying to get an answer right now because we have to take action right now. And it's a, emotionally charged situation. And it doesn't really have to be that way. And so I started thinking about, okay, I need to figure out a way to take my care into that arena as well.
Into a more preparatory phase or stage.
Exactly.
It's kind of like high school. Like they're going to teach you all about, they're going to teach you some math, some government. They're not going to teach you how to pay your bills or or your taxes.
I'll give you another.
All the actual important things in life, right?
Right. In real life, right.
Right.
Well, I'll give you another example is in pediatrics. What we want to do is what we call anticipatory guidance. And so you got a new mom and a new dad, and they've got this new baby, and we want to give them information about, okay, here's what you can expect to happen over the first 12, 24 months of life. You can look at they're going to need these vaccines at these months, and on these visits, we'll be doing this. You should be seeing your baby start to do these things at 2 months, 6 months, 9 months. And so you have kind of a heads up on what to expect. And then if things are not really going according to that description, you've got some questions that you can ask and try to figure what's going on, but you're not totally in the dark. And I thought that's really what I want to do, because let me tell you this, whenever I would bring up the issue of advanced care planning or end of life planning, what would come to everyone's mind would be a bad news conversation, a delivering bad news conversation. And they're not the same thing, but that would be the response from whether I was talking to other doctors, friends, family, and even that's what would come to my mind at first would be, okay, you got a test report and the doctor's going to give you this bad news, and now we have to make a decision. It looks like it's cancer. It looks like it's a heart attack, and this is the first time people are having this conversation, and when there's an event like that. But if you're talking in terms more of, and that's an urgent, if you get bad news, we got to make some decisions right now. And that's what would come to people's mind when I would mention advanced care planning. But advanced care planning is more the anticipatory guidance. Okay, here we are today, and toward the end of life, you can anticipate these changes. And here's how we can prepare for these different stages between here and the end.
Can you walk me through the stages? Like, I know, like early childhood development, but
Yeah. Great.
What is the opposite of that? What would you refer to?
Well, this is actually something that came out of the nursing literature, and it was called the chronic illness trajectory. They gave 9 stages. Yeah. Kind of technical sounding, right? But they gave 9 stages, and you can get a handle. And I kind of modified it for my use. So the stage 1 is really before you have a diagnosis. So let's say you're totally good health. You don't have any heart trouble. You don't have any aging ailments and things like that. And what I did, which seemed to be helpful, was for each stage, I also had an action plan for people. So, okay, if I'm at this stage, how do I recognize and what do I do? So phase 1 would be more about prevention because you don't have anything. and also early detection. So that's
So
where
with
you get your screening and stuff.
So prevention's phase one of this elderly cycle of, I don't want to say decline, but decline would be prevention literally from birth all the way up until phase
Excellent.
one.
Excellent point. Because and actually one of the
How
doctors
we eat, how we exercise, lifestyle, all of
exactly.
that is going to contribute leading up to phase one of
Exactly.
our perpetual decline to death.
And that's where your vaccines come in. That's where your exercise programs come in because you want to optimize your health,
Right.
you know. But also that includes early detection. So if you talk about older people, that could be your mammograms, that could be your colonoscopies or colon cancer testing. But for a younger person, that could be screening for venereal disease. That could be screening for risk of suicide. And so when I started thinking about this more comprehensively, I thought, and then for women, for example, even from teenage, you want to be sure that your diet is straight and exercise is there because you want to prevent osteoporosis, which
And
doesn't hit you until late, but the roots are in your teen years.
really,
Yeah, that's right.
so,
Because that's when women accumulate most of their bone density. And if they don't get the exercise and the proper diet at that time, then when they get to menopause and start to lose bone, they're actually starting from a state of
lower
loss as
density.
opposed to, yeah.
So cheerleaders, congratulations.
Yes,
You are probably going to live longer.
that's right. Well, a lot of women now,
just do your sports, kids.
well, a lot of women are getting into more resistance exercises with their kettlebells and going to the gym and calisthenics. That's positive. That's the way you work with that. Yeah.
It's one of the best ways of prevention, exercise.
Not only that, but that's a prevention, one of the best ways we know of for dementia,
Really,
cardiovascular, yeah,
all
heart
of it.
disease, even cancer, all of that benefits from physical activity and fitness. So go for it.
All right, do not just sit on your couch, potatoes.
Yes,
You gotta move. You gotta
gotta
move.
move.
Stop watching that cycler on France and go get on a cycle. No,
You may have heard of blue zones. Have you ever heard of blue zones?
blue zones.
Blue
No.
zones. This was, and I don't recall the author's name, but it's an author who was with National Geographic a couple of decades ago who identified like 6 areas around the world where people tended to live over 100.
Ah,
Now, it turned out that maybe the ages weren't as accurate as we thought, but the principles to me seemed to hold. And he identified like 9 things that they had in common. I don't recall all of them right now at the top of my head, but none of them included medication.
weird.
Right.
I bet
Good.
I bet I can guess. I bet I
Go
can
ahead.
guess.
Go ahead and try. What do you think?
Okay.
You're probably going to be right.
So they definitely probably ate fresh local food.
Yes, and vegetable based. Yes.
Vegetable based. They probably had daily activity exercise, which kept
Yes.
them healthy, such as gardening,
Yes.
cutting
Absolutely.
wood, just doing basic,
As their lifestyle.
household chores. Their lifestyle in and of
Yeah.
itself was active. I'm guessing.
You're batting 100 so far.
There's 9 of them, huh?
Right.
I'm gonna say they had good close friends and family relationships.
There you go. You're still batting 1,000. That's right.
All right. Let's go with. I do not have
Well,
a cheat
actually,
sheet here, people.
I'm going to let you take that one in 3. I'll give you 3 points for that one because 1 would be close family relations.
Okay.
2 would be close community or neighbor relations, and 3 a spiritual community as well. So I'll give you 3 points for that one. Yeah.
All right. So I'm at 5. I'm at
Yeah.
5. Oh, gee. Let's see. I'm. I mean,
I'm kind of running out too, so we can
does
stop
water
there.
count in the food part, right? Because I mean, water, just family, comfort, housing, ability to
They didn't mention that. One of them actually was they all drank a little alcohol.
Really?
Yeah.
Just
But
a
I
little.
wouldn't put that out there as a requirement because some people that won't work for them, you know. Some people that might actually be a risk. So that's not as key as the other ones. And I'm going to stop there because I don't remember the rest off my
Touche.
head
Well,
either.
ladies and gentlemen, if you want to go figure out the other four, you can go ahead and comment somewhere.
Yeah, and you can go on. You
We'll
can
figure it
do
out.
your browser of choice and put in blue zones.
Cheaters. I know. I remember. Geez, I think it was the mid '90s, but maybe you remember this too when calcium became this huge thing.
Yeah.
Where like, and where's Mr. Miyagi from? Oh man, where's Mr. Miyagi from? The Karate Kid goes back.
Oh yeah, he was Japan, but that was Karate Kid. Yeah.
Yeah, but it's Okinawa. It was Okinawa.
Oh, okay, Okinawa, right?
Where there was a slurry. There's like this calcium slurry, right? That
Oh,
came off the mountains, right?
I wasn't aware of that one. Okay.
And so this company was trying to package these calcium pills, and that's how they were marketing it. Was that because Okinawans tend to live to be, their average age is like 100.
That was one of the 6 of the areas he came up with, right?
And one of the reasons for that this company said was because of the calcium in the slurry that they would ingest on a regular, and because calcium somehow made us base, right, as opposed to acid. That somehow we were never intaking as much calcium as we should, and also the fact that milk's calcium doesn't actually absorb into our bodies, and
what you eat and so forth.
It actually does the opposite, and it disappeared. But I remember for a good while, like this whole calcium phase and fad of just like you had to overdose on calcium
and vitamin C, and we've had all these other things, but we found that whenever we try to isolate down to one magic pill, that never really works. That doesn't really that's really not the answer or the way to go.
There is no magic solution. It's a combination of
those
9 factors from the zones. Yeah, give me 5. Go find the 4. But truly, I mean, yeah, live, health, eat, exercise, love.
That's and what's interesting is that COVID really hit several of those things because, especially if people went to the gym to get their exercise, they weren't able to do that. A lot of their physical,
which is also possibly their social, social
exactly. So COVID had an impact on all those things in a negative way. Glad we're able to start back to a semblance of normal.
All right. Every time you think it's over, somebody else is sick. Anyway, so we made it through prevention. So
and early detection. Yes, where your screening comes in and things like that. And phase 2 is when you have a new onset of a diagnosis. So that's where, for example, the doctor has a test result and we have to have a conversation. Or you may have a new symptom.
High blood pressure.
Yeah, for example, yeah. Or you may have a symptom. You may have an ache or a pain or something like that, and you wonder what's going on, and that might relate to a chronic condition. And if it does, then that's actually where we are. And the action to take then is let's figure out what's going on. Where is this coming from? How bad is it? What's the plan going forward? So that's what's happening at stage or phase 2. Phase 3 is you figured all that out. The dust has settled. You know what you got going. You know the severity. You made some adjustments in terms of lifestyle if it has required that. You may be at a new normal now if it's something that really has created new limitations for you. And you have a treatment plan that's addressing it, either medications or you got therapy. Or maybe it's just a matter of changing your diet and exercising. The doctors told you had elevated cholesterol and blood pressure. They've got you on an exercise and eating regimen. Maybe that's all you need, but you've got a plan and you're working it,
And you're in the new normal of
your
everyday health.
Yes. Now we call that stable. 4 is where it becomes unstable. This is kind of where I kind of adapted it for my needs. 4 is it's become unstable, but you can manage it in the outpatient setting, either at home or your doctor's office. 5 is where you need to go into the hospital because it's beyond what you can manage in the outpatient setting. 6 is where you're in a critical care setting and it's a life-threatening setting. 7 is recovering. So basically, all that's worked, and now you're in recovering. And so basically, for 4, 5, and 6, it's
Anything
whatever.
could go wrong at any point in 6.
Yeah. Now at 4, I like 4 because that's where if the doctor has provided an action plan to give you the skills to manage at home, then that empowers you, right? Because you
Mhm.
don't have to go to the hospital for everything. And sometimes the doctor can give you instructions for what to do. You don't even have to come to the office. The doctor may say, well, just double up on this pill if you see this change, for example, or change your activity in this way if you start to notice this problem. And then you come to the doctor or go to the hospital if those things don't work. But at least now you have a heads up on, okay, I don't
And you're
have to jump for every little thing. I can do this at home. I have the skills and the support and the supplies that I need.
and you're in the driver's seat.
You're in the driver's seat. That's
The
right.
responsibility is on you now. If you want to.
Well, but what I like about that is that's a partnership between you and the doctor. And one thing I like to communicate to help doctors is when you talk about chronic illness and chronic changes like aging, it's really about a partnership now. It's not just me, the doctor, telling you what to do and go ahead and do it because you may not have the understanding, you may not have the knowledge, you may not have the skills, you may not have the resources to do that. And if I haven't helped you with that and also given you the opportunity to give me feedback,
On how
for
it's working.
example,
Right.
yes. So, for
Because
example,
the doctor is learning. You're at the same time
yes,
the patient is learning because it's a
exactly.
perpetual learning process.
Thanks for saying that because that's really what we're talking about is a learning process. And that's kind of how I approached it. So, if a patient, for example, and I'll say patient because that's kind of what our relationship is. If they say, well, Dr. Jones, I'm just not taking that pill, I'm going to assume that not that they're a bad person. I'm going to assume that they see a risk to that pill that I haven't learned about.
Okay.
So, for example, they didn't want to take that pill because they saw a news report that stated there was a side effect here that worried them. Okay, so I'm giving them permission to give me that feedback. I'm not just going to say, well, you need to just take that pill because I gave you the instructions, I gave you the orders. Or you don't trust me, find another doctor.
Right.
And
That's a
some
hard
patients
line.
have had that experience. Some patients have had that experience. But I find that if I take a different approach, I can actually learn some things. I may, for example, there's one lady I had prescribed a cholesterol medication to. She stopped taking the medicine. Why did you stop taking the medicine? Well, because I noticed that when I take it, my memory doesn't work as well. And I'm thinking, well, let's check that out. Why don't you go take the medicine again, come back in 2 weeks and tell me what your experience was? She came back in 2 weeks and said, same thing happened. I said, I haven't heard that before. So I went online while we were there and looked it up and found out she was right. That there's a certain category of cholesterol medicines that have that impact on some people. And a different category
It just
does
won't
not
list
have
the
that.
side effect from the from the distributor.
No, it's really they're different cholesterol pills that by their chemistry, some will actually impact the brain more than others.
Right. But
Yeah.
when you're watching a pharmaceutical commercial and it lists all the side effects, and you're like, why the
Yeah.
hell would I take that then?
Right. Well, actually, what can be misleading about those is that when you see the list of side effects, you tend to think that they're all equally probable. but a lot of those side effects are rare, but
Right.
seem to have the same weight as something that's common. And so you might need to have a little help or other resource to help figure out. Because what I would ask if someone was concerned about that, I would ask, well, which of these are you most concerned about? And let's look at the likelihood based
And the
upon what
probability.
the reports are. Yeah, because if it's something that hardly ever happens, then the benefit outweighs the risk, but then the opposite can be true as well.
Yeah. Okay. And sometimes they'll even have most common side effects are da 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 da. But some patients may experience da da da.
Right. And that's why I want them to be able to feel free to let me know, because I'm not going to try to shoot them down whenever they say something that doesn't necessarily agree with my plan. I want to find out what they're thinking. Sometimes what will happen is, Dr. Jones, I didn't get your medicine because I couldn't afford it. Well, why couldn't you afford it? Well, because I wrote the prescription. I don't know how much it costs and what the insurance covers. They have to go to the pharmacy and have the pharmacist run it first and see what the insurance covers. And they would say, well, Dr. Jones, they wanted $120 for 30 days. I can't afford that. And I'm thinking, I couldn't afford it either. Thanks for telling me, because let's see what else we can do. Maybe
I mean,
there's
but,
another
yeah.
option, yeah, or different generic, for example, and things like that.
Or we'll just order it from Europe for you.
I can't do that because insurance
Canada.
won't cover it. But
Right.
anyway, people do that though, or Canada,
You'd think insurance companies, not the pharmaceuticals, but the insurance companies would favor that because, the pharmaceutical companies around the world,
Yes.
they're not allowed to get away with the price gouging that they get away with in America.
Well, what happens there is that each insurance company has their own contracts with the
With
different vendors. And
Mhm.
so we don't know what's going to happen until the pharmacist actually runs it. And
That's the
then we
first,
can actually go to a different one, a different option when they're available. Yeah.
one of the first things to collapse in the future, pharmaceutical industry.
You think so? I don't know, because
Oh,
everything
yeah.
seems to be to they're at the table. It seems like they've got a seat at the
It's
table. So
they have a huge seat at the table, but the
yeah,
problem with
yeah.
their seat at the table is that, and in the new world, is that we see you, right? We
Say it
see
again.
we see you. We see
Yeah,
them. They
that's
are
the
visible
whole.
now. Their
That's what you
evil
want.
their evil is pertinent and visible, and they
Right.
can't get away with it anymore because the people vote with our money and our choices. And when we start choosing alternatives, when we start just choosing our food over your pills, when we when food returns to nutritional levels that keep us healthy, and that's a problem in and of itself,
Mhm.
you know and we live in a society that has done so much to try to drain out all of our actual nutrition and ability to maintain a just health vis-a-vis our environment. Then and we see that, we know I think we're on the opposite side of what was one of the biggest catastrophes in human health ever.
Mhm.
which which
That's
which
that's
which,
one
which
of
is
them. Yeah.
which is
Another is
the
the antibiotics
corporate
that are in
food.
all. Yeah. Because the industrialization of the food supply, you've got a lot of antibiotics now in the whether you're talking about.
Animals. Yeah.
Yeah. And so that's the bigger cause of resistance than our prescribing. But you hit on something that's very interesting, because what do you think about this? If someone is paying like $50, $60 a month for medication, but instead we're able to, instead of buying pills, we're able to apply that to growing their own food.
Or growing their own herb, or because
Yeah,
all pharmaceuticals are derived from plants. People forget that.
exactly.
So if you just go back to the plant that had all the things in it to begin with, well, there you go.
Yeah.
But there's no money in that.
There's no money in that. There's no money in that. Although I guess there could be a different industry that could do that and support that, but the industries that are already established are going to resist that. So,
I mean, you have them, but they were all quacks throughout the 60s, 80s, 90s. Any holistic medicine throughout that period of time was looked down upon or made fun of. And
yeah.
now we're in an entirely different world where it's actually, herbalists and even homeopathic medicine has become more mainstream and
It's kind of
not.
like getting away from petroleum as energy sources. Other sources were looked down on and resisted, but now um, it's a bandwagon that people are trying to get on somehow.
Right? You're like,
Yeah.
no, you can't just stick needles in people and make them feel better. Really? Well, the Chinese have been doing it for millennia. So
Yeah.
I think
True.
you're wrong.
Yeah.
Uh,
Well, I would say that as phase 7 is where you're recovering. You've been through 4, 5, and 6, and now you're recovering. And the treatment plan there is pretty much whatever if you're in the hospital, what the discharge plan is. What instructions do they give you that when you go home, do this, and your healing will continue, and then come back to the office or the specialist. 8 is when recovery is not going to return you to a level 3 stable, but instead, in spite of our technology and medicines and everything, either the illness is going to run its course now, it's going to have its way, or you're such advanced age where aging is going to have its way. 8 is really the downturn. And 9 is the last period toward dying, the last months or weeks toward dying. And 8 is where I would say this is where palliative and hospice needs to take place. What has happened is people tend to look at hospice in phase 9 when the person is dying, and they really haven't had the benefit of preparing for, okay, if you don't have technology or interventions that are going to cure, let's bring in the other set of big guns in terms of what can we do to help you maximize your comfort, your relationships, your ability to bring closure. Maybe there's fellowship that you heal, maybe relationships you want to heal.
and maybe we throw the party now.
You want to have a party. You want to have a party. Talk about that. That's so powerful what you're talking about there.
Yeah. So my mother does these end of life party things where she takes, they literally have all their friends and family come, and they have the party before they pass. So they basically get to hang out at their own funeral, which
Exactly.
which sounds depressing, but actually way less depressing than the actual funeral, I'm guessing.
That's life affirming, man. That is life affirming, because not only is that helping closure and relationships for the one who's going to pass, but also you got family history coming there, because this is really a family event that helps to build legacy in the family, and what's a better way to leave a gift behind for those who are going to be there when you're gone.
Right? Those the last memories are not in the box.
That's right.
That's right.
That's right.
You got a book, right?
Yes. And now the book is really the work we've just been talking about has to do with supporting family caregivers. Um, that's what I've been working on most recently. But I'm also working with doctors, and the book is really geared toward doctors. So I try to write it more toward 8th grade reading level, so that lay people who are interested can still get some value out of it in terms of how to communicate with the doctors. But also, you would think 8th grade reading level might be talking down to doctors, but I really wanted it to be an action taker. So I didn't want doctors trying to figure out what was he actually trying to say when he said that. I want them to be able to just grab that and then try to put it into practice and see if it worked for them.
Right.
And
Just
if it's
a
not
simple
working, give me some feedback, because I want to be able to make it better. But I didn't want them struggling with the technology and the lingo and everything, and say, okay, because it's not about theory, it's really about application. Using those 9
action
stages
and
that I mentioned,
interaction. Right?
interactive, yeah. Because the model I wanted to have is the 9 stages we talked about. They're mileposts on a road trip. So it's like a road trip model from where you are today toward the end of life. And you're going to go through these 9 mileposts, right?
The
And each
destination just happens
milepost,
to be the end
yes,
of here.
yes, yes. And so this is a way the doctors could communicate it to their patients, and patients could also visualize it and grasp it for themselves. It kind of takes you out of the realm of being super theoretical and technical, and bringing it down to earth where we can actually make use of it for our conversations. I like the approach for the family caregivers, because if you're taking care of and you're responsible for the care of a loved one, you have to make decisions. That's what it comes down to, is having to make decisions when things come up. You want to be able to defend those decisions to yourself, first of all. I don't want people going on guilt trips or being put on guilt trips because after all that effort, they're still afraid that I didn't do enough. I should have done more. That's
Just
tragic to me.
because you didn't ask the question to begin with.
Yeah, yeah. So
Right.
this helps you to know what questions to ask. You can make decisions. You can also defend those decisions with other family members, because other family members weren't there to hear that conversation or to provide that care. So they wouldn't necessarily understand. And this will help you to have a way of concretely informing them, because
Yeah.
they're going to be involved in the decision one way or the other, even though they're not the primary decision maker. They still are part of the picture. And then
Definitely help in a
sometimes
lot
you
of
have,
sticky situations.
yes,
Argue.
absolutely. You know, that's exactly right. And I've seen some of that.
I bet.
And yeah, more than we know, right?
Right.
And then sometimes they have to defend their decisions to other professionals or doctors. I've seen situations where you have to take your loved one to a specialist who disagrees with that treatment plan, or to the emergency room doctor who wants to push back against that treatment plan, but they weren't there when you arrived. We're going through all the process of arriving at this treatment plan. And so the better you have clarity and understanding, you can be an advocate for your loved one, even if it requires confronting other doctors.
All right. So you have the roadmap.
Yes.
Forrest, what are you having for dinner tonight?
You know what? My wife made, she has this vegetarian pasta. I think the main ingredient is zucchini. I love pasta, and so this is really a good alternative that's healthy for
Mm-hmm.
me. And she has in that uh, ground turkey, and also bell pepper, onion, and what else she put in there? And mushrooms.
And
So
mushrooms.
that's what I'm looking
Well,
forward to.
that sounds lovely.
Yes.
Tell her she's gonna have to send me her recipe someday. Would you like to give any shout outs? Where can you get your book, et cetera, et cetera?
Well, you can reach me through chatwithdrjones.com.
Chatwithdrjones.com.
Chatwithdrjones.com. And that way, I'd like to be able to talk with you if you have some questions about how I might be able to give you more information. And also have a handout in terms of um, kind of summarizing what we just talked about.
Yeah, I mean, if anybody out there is, old enough to be dealing with, the older ones in our lives making their way to the other side, Dr. Forrest Jones is here to help you on that transitionary period. Thank you so
And
much
some
for
may
doing
not
that.
be that old. I've seen a number of caregivers who are actually the grandchild.
Oh, yeah. Yeah,
The
yeah.
grandchild. Yeah.
Mm-hmm.
So they're involved as well. Yeah.
It's never too late to start planning that party. Make sure you have the party, because
That's
you never
right.
know when the party's going to end.
Exactly.
I don't
Exactly.
know. I'm not walking a fine line between trying to be fun on a depressing side.
Well, it's all life. We're talking about life, and basically that's part of life. And we want to basically not only acknowledge it, but actually it can be honored. And that's what your mom is doing. And that's
Mm-hmm.
powerful work. I certainly encourage her with that.
It's not the end, ladies and gentlemen. It's just the beginning.
Just the beginning.
Just the beginning. Ladies and gentlemen, thank you so much, Forrest, for being here today. I appreciate it so much.
My
And
pleasure.
go check out his book. Go have a chat with Dr. Forrest Jones. He's super informative, super sweet guy. I wish you were still practicing and I would have lived in Chicago. I would have had you as my doctor. Please go watch my television series Beyond the Check on Tubi TV and Amazon, and go follow us on Taste Made. Cheers.